The residency here really is a strong academically founded community hospital residency program. We have a wide range of subspecialty faculty that normally one would not have in a hospital this size, with expertise in bone marrow transplantation, cardiology, interventional GI endoscopy. So really for an institution this size, the variety of academic activity and quantity of academic activity is pretty much unparalleled.
Our residency program at Roger Williams is unique. Residents are given autonomy in managing their patients under the supervision of board-certified internists as well as board-certified specialists. So medical residents play an integral part in the management of patients in our hospital.
A core 6 months of an internship here will primarily be based on our wards, where residents will function as the primary caregivers for a group of patients. I, as a hospital attending, am here to provide additional guidance, provide support, but I'm not the individual who is generating the plan for management for the day for the patient. My expectation is that this is what the residents are doing. And by doing that, the residents are learning. They're also developing important bonds with patients and also developing their communication skills with all the rest of the team.
Our residents are highly sought out by other residency and fellowship programs. And I'm very proud that when they come from our program, that I get calls on how great our interns and residents are.
I love resilient residents, ones who can barrel through it, and because that's what this is about. And it doesn't matter where you go or what kind of medicine you practice, you have to have flexibility and you have to be resilient, because this is a hard job.
This is a program where people really learn by doing. We really want residents to take responsibility. We want residents to be fully invested in the care of their patients. When he assumed the directorship of the program, Dr. Arminio made it very clear that one's academic performance and performance on boards was going to be a key priority. So in addition to routine lectures and board reviews during the course of the academic year, a focus on discussion on questions, the overall level of academic rigor has increased.
We have extensive rounding every day. When they're on the inpatient wards, they get significant didactics when they're in their outpatient clinics or their second site clinics. There's board review courses every month.
Additionally, we provide for all of our third-year residents during their third year to go for a one-week board review course to sort of solidify everything that they've learned several weeks before they take their boards. And we've been very fortunate in the last 2 years to have all of our first-time takers pass the exam.
We're proud of that achievement. I think there's a lot of hard work that's been going on in terms of the residents. The faculty, again, has been very dedicated in terms of achieving that goal, and we've seen that in the last few years. And that's something that we continue to be proud of and continue to strive to do.
When I was looking for programs, I was looking for sort of a smaller program where there was like a lot of interaction with the attendings and the program was close-knit. And when I interviewed here, that pretty much sealed the deal for me.
When looking for residency programs, I talked to other people from my school, upperclassmen, where they applied. After visiting Roger Williams, it's the people. Just meeting all of the residents that day, the chief resident, the program director, even the attendings who interviewed me, that's when I knew I wanted to be here.
Roger Williams, for me, and I think for a lot of the residents, is like family. And we enjoy really getting to know the residents and introducing them to Rhode Island and the fun things to do here, and the fact that as you go through your career, you have to have a life outside of the hospital. It really, really matters, because you can't be a good doctor if you aren't a person.
I love them. They're hilarious, they're helpful, they're kind, and it's fun to work with them. When you're spending 15 hours a day with someone, it's important if you get along.
It's a small place and you get to know and love the people you're working with, which again renders it unique in my experience. And then the smallness turns into quite an asset because of the time that we're allowed to spend with you one-on-one or in small groups.
We have really good faculty interaction here. The attendings trust you, and they will allow you to come up with your own treatment plan. We'll go ahead, put in all the orders ourselves. Then we'll talk to the attending later and say, hey, we did this. Do you think that's okay? Do you not think that's okay? But they leave it up to us. They trust us to make our own decisions. Everyone wants to teach and wants to see you do well, so it's great.
What I want in an ideal candidate for this program is someone who wants to very actively participate in their acquisition of medical knowledge and clinical skills, and someone who's going to contribute to the community in a positive way, both inside and outside the hospital.
If you are willing to come in every day with a smile on your face and work collaboratively with other people and be creative and work hard and love what you do, then we love to have you.